we are going to be hit even harder by this Delta variant that is going on. Folks, health officials say all Americans will now have access to COVID booster shots beginning next month. The U.S. Center for Disease Control and Prevention, the U.S. Food and Drug Administration suggests getting the booster shot 8 months after your second dose to be made available beginning September 20th. The CDC believes up to 664,000 deaths will be reported by September 11th. Now, folks, the country has more than 37 million reported cases and 640,000 deaths. Today, President Joe Biden said we are still in the pandemic of the unvaccinated.
That cases may be declining in a few places. Cases are still rising, especially among the unvaccinated. There are still 85 million Americans who are eligible to get vaccinated or remain unvaccinated and at real risk. Across the country, virtually all of the COVID-19 hospitalizations and deaths continue to be among the unvaccinated. In Alabama, more than 90% of the current hospitalizations are among the unvaccinated. In Texas, 95% of those in hospitals are unvaccinated. Right now, it's worse in states where overall vaccination rates are low. But let me be clear, even in states where the vaccination rate is high, the unvaccinated in those states are also at risk. And we're seeing cases rise as a result. Quite frankly, it's a tragedy. There are people who are dying and who will die who didn't have to. So please, if you haven't gotten vaccinated, do it now. Do it now. It could save your life, and it could save the lives of those you love.
Well, folks, in New Zealand, they got some common sense. New Zealand put the entire nation on strict lockdown for at least 3 days after finding a single case of coronavirus infection in the community there. Throughout the pandemic, the country has reported more than 2,000 cases and 26 deaths. New Zealand managed to stamp out the virus, and the last outbreak was in February. Joining us now is Dr. Joseph Graves, Jr., Professor of Biological Sciences, North Carolina A&T. Doc, glad to have you back. So, okay, I need you to first explain this, Doc. These people are going, well, people who got the vaccine, they still getting COVID, so why should I take it? A year ago, you explained to folks that the vaccine that is actually being developed is specifically for COVID-19. That when there were strains and when there were variants, then that vaccine is not as fully effective. And so I've seen these people are now saying, well, how are people dying who still had the vaccine, but they then got COVID?
Well, I mean, Roland, this is really, really basic. The vaccines are effective and safe. They protect you from getting serious cases of COVID-2019. People who have been vaccinated are not dying. They're not being hospitalized. However, the original vaccines were designed for the original SARS coronavirus variant. A year has gone past, and as the president said in his news conference, about half of the eligible people in the United States have not been vaccinated. And that group of people is allowing the virus to warp speed its evolution so that it becomes more transmissible and more dangerous. And to give you a clear representation of how much dangerous it is, when SARS-CoV-2 started, it had an R0 number, the number of people that it could infect from one infected person, of around 3. The Delta variant now has an R0 of 9. And that means in 10 generations of SARS replication, it will infect 9 to the 10th power people. And so we're at a situation that should have been avoided by using some simple common sense, which unfortunately, the half of the people in this country, and unfortunately we know who that half is, most of those people who voted for Donald Trump in the 2020 election, see vaccination as some evil plan. But in fact, vaccination is the way that we get in front of this virus, and it's the way we return to our lives. But if we don't get vaccinated, things are going to get a whole lot worse. And it's going to get a whole lot worse a lot sooner than people can imagine.
Okay, and so we're still dealing with these folks who are just crazy and outlandish. You've got DeSantis and Abbott who are refusing to actually allow mask mandates. You have that going on, and you're dealing with folks who just I'm already seeing this whole deal. Okay, I don't know what's in it. I don't know what's in the booster shot. Somebody tweeted, I saw this interesting deal. They said, well, you didn't know what the hell those 11 herbs and spices in the KFC chicken is. I mean, you didn't order that chicken. And so you keep hearing that. How do you respond to all the folks out there who are saying, oh, yeah, you don't know what's in the vaccine. You don't know what's in the booster shot?
The way I respond is simple. COVID kills people. We don't have a single case of a person dying from the SARS-CoV-2 vaccine. In fact, what the SARS-CoV-2 vaccines have done is they've saved people's lives. And so it comes down to some really simple things. If you don't value your own life, then what about the lives of the people you care about? What about the lives of the people you love? Now, we have teachers going back into classrooms this fall without mask mandates and without vaccination mandates across the country. Now, a lot of these teachers have young children, so they're going to be going into situations where they can possibly pick up the COVID virus from asymptomatic people and then take it home to their children. And we now know that the Delta variant is making children sick. American hospital beds are running out. And a lot of those people in those beds now are young kids who, unfortunately, aren't yet eligible for the vaccine. So if these people have any decency whatsoever, they need to start thinking about people other than themselves, and they need to examine why they believe these idiotic things that they believe.
So then you have the folks who are, again, who put stuff out and they're like, well, you know, I trust the Lord, natural immunity. I'm looking for this. Somebody sent me this post earlier. Apparently, Laila Ali posted something today that caused people to say, you know, what the hell are you talking about? And so here it is right here. Let me see if I can actually pull this up. Give me 1 second. I saw it. I didn't know if it was legitimate, but apparently she had posted this on her Instagram stories and not necessarily. So this is what she wrote. Now, mind you, Laila Ali has got like 4 million Facebook followers, millions on Twitter and Instagram. People don't seem to understand that just because some folks don't wear masks, don't want the shot, don't listen to the media, or live in fear, it doesn't mean they don't believe the virus is real or think they can't get it. They know it was created to harm humanity. They simply choose to build up and trust their own immune system like they have been doing all their life. If they get it, they will deal with it. It's a God-given choice. I know this kind of faith is impossible for some to comprehend, but lean not on your own understanding. Before you claim they are putting others in danger, you should do your own research to learn if that's actually true. You can't change anyone but yourself, so you do you. Real talk, Laila Ali. Doc, how do you respond to that?
Well, the first thing I want all your viewers to know is that not only am I a research scientist, but I'm a confirmed Episcopalian. I go to church every Sunday. I've served on the COVID vaccination task force of the Episcopal Diocese of North Carolina. This morning, I was in a session with the faculty and the staff of the New Brunswick Theological Seminary. These are people who study the Word of the Lord and who are in service to their communities. And none of them are saying things like that. And so, you know, we have had a history of some bad science, And we've also had a history of some bad theology. And so, I do want people to think for themselves. I do want them to be introspective. I do want them to have strong faith. But, in the words of the famous joke about the man who was sitting on top of a house in floodwaters, and when the boat came to rescue him, he said, I don't want a boat. I'm waiting for God to rescue me. And then when the helicopter came to save him, he says, well, I don't want to get on the helicopter. I'm waiting for God to rescue me. And then after he died from the flood and got to heaven, and he asked God, why didn't you rescue me? Well, God said to him, well, I sent you a boat and I sent you a helicopter. And so that's where we are, okay? We have God-given intellect, which has allowed us to develop one of the strongest biomedical and biotechnology research infrastructures in the world, and hospitals and medicines that can prevent people from getting sick and dying. The SARS-CoV-2 vaccines are the result of the tremendous advancements that have occurred in the last 20 years. When people say the vaccines came out so quickly, the reason they came out so quickly is because our science and understanding of how to make vaccines went through a huge jump in the last 20 years. And so when we have something that is as valuable and as important as this technology, which can save lives, it just seems to me that this is not good theology to say, oh, well, let's just wait for God to send an angel rather than a helicopter. Again, as a person of faith, I have to stand resolutely against that kind of a bad religion.
Well, Pastor John P. Key, I think probably is in line with you. He put this on Instagram today. We're going to try to have him on the show tomorrow. This is what he said. This thing seems to only hit home when it affects the people you know, hashtag your family. Today, I've received tons of horror stories that I will not post. I'll go out on a limb and tell you I believe this disease is preventable. We pastors beg you to take the necessary precautions, and you laugh, mock, and criticize us, and now your family is angry because the church won't handle your $12,000 funeral expense.
Says it all, Roland. It says it all.
It is crazy out here. Dr. Graves, thank you very much for enlightening us with real information. I have people sitting here hitting me up saying, why won't you have so-and-so on? And my first thing I say, is this person a doctor or a scientist? If not, I don't want to hear a damn thing from them about COVID-19 or the vaccine. I don't want to hear, I'm not putting conspiracy theorists on. I'm not putting these fools on and all this, oh, so-and-so. And again, when Layla's like, oh, do your own research, that's part of the problem now. We got a whole bunch of, Google doctors out here who all of a sudden are saying this, when these are the same people, Doc, who have allergies and got no problem taking Zyrtec D, or any of these medicines, and they ain't got a damn clue what the hell is in that allergy pill. They get a headache, they take Tylenol or leave, they ain't got no clue what's in that Advil or that Aleve or that Tylenol. And so it's just amazing to listen to these people who, many of them are on high blood pressure medication, diabetes medication, thyroid medication, hypertension, all this sort of stuff, and they sitting here going, oh, I don't know what's in it. Like I keep saying, ain't no flip side to death.
I'm completely with you, Roland. If you're going to build a bridge, you don't tell people do your own research and then go out and build a bridge. I mean, there are people who went to school, who have training, who are professionals in the area, who are engineers, who know how to build a bridge that's not going to fall down. In the same way, with regard to medicine and science, there are people, and I'm not saying just white folks, there are credible research scientists who are African Americans who have been working to help end this pandemic from the very start. In fact, as I'm sure I've said on one of your earlier interviews, one of the people who helped design the Moderna vaccine, Dr. Kitzbensia Corbett, is an African-American woman who graduated from UNC Chapel Hill and is now at Harvard at the Chan School of Public Health. So if folks won't listen to us, I don't know what kind of research they're doing. Because if I want to build a bridge, I'm not going to go to somebody who builds shanties for a living.
Well, in fact, I'll leave it on this point. It's a whole bunch of folks taking vitamins. They probably haven't even read the back where they say the FDA, the Food and Drug Administration, has not approved any of this, but they actually believe that those vitamins make them better.
Yeah, and that's one of the things that we're working very hard, particularly at North Carolina A&T, to do, to build more African-American students who go into engineering, into medicine, into biomedical research. We have, leading academic institutions that are working to help end this pandemic. And so one of the things I'll say to your viewers, if you want to see this end, you should be supporting your HBCUs.
Absolutely. Dr. Graves, we appreciate it. Thanks a lot.
Thank you, sir.
Folks, back to our Roland Unfiltered video in just one moment.
Football bans and one of the best fan experiences in the country. The Cricket BX SWAC Challenge kickoff returns to Atlanta on August 28th, along with special guests, College Game Day. Then Alcorn State takes on North Carolina Central with conference bragging rights on the line. Center Park Stadium is the place to be on August 28th. Come tailgate all day before enjoying a primetime matchup on the gridiron. You don't want to miss this. Check out MEACSWACChallenge.com for more information.
And of course, we'll be live in Atlanta August 27th and 28th, supporting the SWAC MEAC Challenge in partnership with Coca-Cola. Friday, we'll broadcast the show from the Atlanta Braves Baseball Stadium, interviewing officials with the SWAC and the MEAC, plus the university presidents. On Saturday, August 28th, we'll be broadcasting live from the Coca-Cola fan zone outside of the stadium. And then, of course, we'll be live streaming the halftime show and the performance after the game. So check out Roland Martin Unfiltered from the SWAC MEAC Challenge in Atlanta. And don't forget, the game airs at 7 p.m. Eastern on ESPN on Saturday, August 28th.